Good morning, everyone. I think your mic is the one that's working. Good morning, everyone. Welcome, welcome, welcome. We're about to start the program. Thank you so much. And would also any of you sitting far back, please come join us closer. Thank you very much. And I'm going to turn this to David.
Good morning, CORE. This is a great group and really lots of shining faces out there. So welcome to everybody. I'm David Pyle. I'm the acting board chair right now. I welcome you on behalf of Erin Stiver, who is the board chair, but she's on maternity leave right now. She is practicing what we all preach, quality infant care, with her brand new daughter, Clara. So we hope to see her sometime maybe during this conference, but she is sorry not to be here this morning. We have a very exciting 4 days ahead of us. The topic of this year's conference is of tremendous importance, dealing with the community health and the humanitarian development nexus. Nothing could be more critical at this time than these 65 million people who've been forcefully displaced from their communities, from their homes. It's a staggeringly high number, some number that I have a very difficult time comprehending. What does 65 million people actually equate to? If it were a country, if all these people were within a boundary in a country, it would be the 22nd largest country in the world. It would be somewhere between France and the UK. Or if you want to put it in US terms, it's 7.5 New York cities. Just try to imagine that. The number is catastrophic, and I strongly believe that CORE can do its part, or our part, to improve the health and nutritional status of the desperate population while improving the quality of their life, both in the short term and in the long term. I look forward to our discussions on how what progress has been made, what progress is being made, and what progress will be made in the future. But right now, to lead it off, I would like to introduce the Executive Director of CORE, and it gives me great pleasure to introduce Lisa Hilmi, who will take on the proceedings now. Thank you very much and have a great week.
Great. Good morning, everyone.
Good morning.
Really excited that you're here, and welcome to the 2018 CORE Group Annual Global Health Practitioner Conference. We changed, as many of you know, to now we have an annual conference, and we are looking for 2019 to have an annual as well as a regional conference out in Africa or Asia. So we'll be hearing more about that tomorrow at the members meeting. We're very excited to welcome over 280 participants, and this is a record number for CORE Group. So I hope that we put enough seating, as there's still a long line and we'll have only a couple tables left. So please make room for our colleagues. We welcome them from Africa, from Asia, from Europe, Canada, South America, and around the United States. You are the change makers for the community, and so we're very excited that you can be here together to network. CORE Group conferences are built on collaboration and learning to solve some of the biggest challenges that we face as practitioners, researchers, donors, and ministries of health, and others. Putting all of this together takes a lot of work and commitment. So at this time, I'd like to start off by thanking some of these people that have helped put this together. First of all, I'd like to thank our amazing CORE Group staff, and I'm going to name your names, and I'd like you to stand up, please. So Erin Murray, who's out at registration, please say thank you to Erin. I'm sure all of you have talked to her at one point. We have Sheila Jackson, Mark Holler, Ashil Kabore, Yemisi Songa-Williams, Adrian Tadella, Comfort Cialdaz, and Chelsea Graham, Chelsea in the back. And you'll see a lot of new faces, so thank you to everyone. I'd like to welcome and thank our working group co-chairs. Can you also please stand, those of you that are here today? The volunteers, everyone that's in the room, thank you. Our technical review committee, the board of directors that are here, please stand. And our wonderful conference organizer and facilitator, Mohini Malhotra. And you'll be hearing more from Mohini later. I'm very grateful also to our multiple sponsors whose support enabled this conference to occur. Core Group doesn't get grants to actually produce these conferences, so we rely very much on our sponsors. So I'm very happy to mention some of these. We have the visionary sponsor Eleanor Crook Foundation, Medtronic Foundation, Core Group Polio Project, ADRA, JSI, the Global Health Council, Save the Children, World Vision, JPIGO, MedAir, the Maternal Child Survival Program, Chemonics, Global Impact, JPIGO, and USAID. Thank you very much. Again, this was a record. I keep saying this is a record, but this is a record sponsorship level for Core Group. So thank you very much to all our sponsors. As David mentioned, this year's theme is very important, the community health impact for the humanitarian development nexus. We have nearly 5 million people that have fled Syria since 2011, 25 active conflicts that are ongoing, and coupled with the poverty and development issues that we face on a normal day, it makes achievements toward community health and the sustainable development goals even harder. In the next 3 days, we hope that you and us will gain a greater understanding of why this humanitarian development approach is important in achieving our global vision and health for all. We hope you'll contribute and learn and gain new ideas and action on how to advance some of these evidence-based policies that some are just emerging, new strategies and new partnerships, and how to practice in this very complex and dynamic area. Around the room, there are new partnerships to be made for future collaboration, so take advantage of this. I just heard one of our volunteers, Josh, from University of Iowa, mentioned that he received an internship from attending the past conference, and hopefully a practicum. There's also a lot of students in the room, so we'll introduce them later so that you can meet them and see their skills. And we also want to gain an awareness of the programmatic and research questions that drive the work, and what are the remaining gaps that we need to look at. We know that many of the people in this room work in the development context, but when conflict or disaster or an outbreak happens, we find ourselves in this fog of humanitarian and development. And with many actors, and we're really not sure sometimes how these are aligned, but we know that the community initially acts on most of these cases, and they also have the greatest needs. We need to move from the humanitarian divide more towards the humanitarian development nexus. And we'll be hearing a lot more about this from our keynote speaker, Dr. Paul Spiegel. Core Group recognized the need to bring the different stakeholders together, and we created in 2017 a humanitarian development task force. You'll be hopefully attending either that working group meeting during the conference or many of the other working group meetings that will occur. And then the theme of this is very important to me personally. For those that don't know me, I'm a nurse and a public health professional, and I started my global health career in Somalia. And I originally was supposed to assist the government set up the community health infrastructure. But then war broke out again, which led to cholera camps, which led to drought, famine, and severe malnutrition in feeding centers. And it really was there in Somalia that I decided to also become a nurse. So for all the frontline health workers in the room, here's to you that are out there on the front lines. And on a personal note, we all probably have heard in the news of the frontline health workers, the nurses, the doctors that have lost their lives in humanitarian situations, but also in the development context. So I'd also like to remember them and think about them today. I encourage all of you to take advantage of the diverse group in this room and begin those new partnerships. There's some provocative sessions, and we have new frameworks, new evidence that's emerging that will be out there, as well as discussions on financing, which we found was really a gap in this discussion. So very excited to start the conference, and at this time it is my pleasure to introduce our conference coordinator and facilitator, Mohini Malhotra.
Thank you.
Spiegel.
Thank you, Lisa, and good morning to all of you. I have to say, I've just so been looking forward to this conversation, only because I know a lot of you by voice, and it's always a joy to put face and voice together. I'm a development economist by background, and I've spent the last few decades at the World Bank. And I think when I spoke with Lisa early on about this conference, what really pulled me in and inspired me was I feel in development we all come into it with deep core technical skills, which are necessary. But in addition, to move the needle forward and to do the incredible work that you all do on the front lines and every day, saving lives, keeping people healthy, making our world more fair and more just, more equal. It's important to come together and share practice, evidence, lessons, and I can't think of a better use than public and private funds towards raising the bar and moving forward into action collectively. That was the second thing that pulled me in, Lisa. I think what I realized, I actually as a facilitator, I started off saying, I really hate conferences. But I hate conferences that are just talk circuits. And what really struck me in the conversation with CORE was that this is a point in time, at an early point in time on a fundamentally important issue. And it is about action and what happens, what do you take away with the ideas that come together for this conference into the work that you do on the front lines and the incredible work you do. So I was very inspired by that. Thank you for that. In terms of the architecture, that was the third thing that pulled me in, because I feel like CORE is the architect and creates this incredible space and network, and you came in and you crossed geographical lines and organizational boundaries and expertise lines to create this conference. You're all the co-architects of it. And so each of the concurrent sessions are wows. Each one pulls in multiple perspectives and a diverse set of ideas and practice to raise that bar. I think the hardest thing for this conference for all of you is which session to go to, because your choices are fabulous, fabulous, or fabulous. That's a terrible place to be in, right? I mean, it's very inspiring to have had these conversations with all of you. And the architecture of the conference is also, most of the time, you're in breakout rooms. There's very little plenary, actually. The next plenary today will be at 4 o'clock here for Innovation Bursts of Science. But most of the time, you're in concurrent sessions, or you're in the new information circuits, making choices of which one to go into, and as I said, fabulous to fabulous. And there are lots of opportunities for networking in the smaller sessions, but also social hours at the end of each day. In terms of logistics, you have this conference book in your bags, and I would use this as kind of like the Nobel Prize winning piece of literature for the next 4 days. It has bios, it has deep session descriptions, it just has a wealth of information, including how to connect with each other during and after or with the various working groups. How do you tune in, how do you build out, how do you partner? It's all in this book. A really important page is the last page, and it's a bingo game. And Aaron, sitting outside, has prizes for those of you who fill in the bingo game. So I would start already thinking at the next coffee break how you start filling in. There's even a grand prize, I hear. You do have a map, the layout of the space. This is the plenary. The concurrent sessions, there are 3 rooms, 1 level up for the concurrent breakout rooms. Coffee and lunches will be right outside where breakfast was and where registration was. Because we're in different spaces a lot, you will hear a very calm, meditative gong sound to either signal the end of a session and to invite you to move into the next one. We really encourage you to use social media. I believe you all have the hashtag for the conference in your bags and on your tables. And the idea for that is to share quotes, ideas, innovations, also to just share the wealth of what's happening in here with colleagues all over the world who don't have the privilege or couldn't be here with us for the conference. The usual on cell phones, we'd so appreciate if they're muted and conversations, if they have to happen, take place outside of the room. We have wonderful volunteers. As Lisa introduced them, we'll have a formal introduction at the plenary at 4. But any questions they can answer, any questions the core team can answer, so please use all of us. I'll say just a word on the bags. And the reason I'm saying the bags is because they were made by the people you worry about every day. They're made by underprivileged women in India. We source them from an organization that works on, they're called Coexist, and they promote environmentally good practices, so it's called the Use Me Again bag, and it provides a source of income for women escaping largely gender-based violence. Quick questions before we go, just a sense to see who's in the room. Who has traveled the farthest to get here? Would you please stand up, and we might have some competition. But who believes they've traveled the farthest? If you could just stand up and tell us who you are and where you came from. Sorry, if we could just get a mic to you, Shweta. Thank you.
Good morning, everyone. I'm Shweta Verma. I'm based in India. I work with Children International. Almost 19 hours flying time, probably.
Oh.
Yep.
Does anybody want to try to beat 19 hours of flight time?
Hello everyone, my name is Mamta Rajvanshi and I'm from Nepal. I traveled for 22 hours and I work with Young Women for Change. Thank you very much.
Shweta ji, I'm from Nepal as well, although I just traveled 1 mile, but welcome. How many of you have been to a core conference before? Or if you could raise your hands. Wonderful. So and who thinks they've been to the most number of core conferences?
Oh.
No? Any takers for the most core conferences attended? Well, I think we're in good company with those of you who are veterans and those of us who are first-timers, so we'll lean on you for that. And before I hand over to Lisa to introduce Dr. Paul, I just want to know, I know Lisa mentioned this continuum or humanitarian and development professionals. Could I just ask those of you who identify as humanitarian professionals to just stand? Thank you for the work that you do. Can we assume the rest of you are development professionals?
Yeah.
Thank you so much for the work that you do. And do some of you in the room feel you straddle both? Thank you. This is just a quick intro. We have many more opportunities, but it also gives us a sense of how much we can draw on the collective wisdom of this room to move the agenda forward that Lisa laid out. Thank you all. Over to you.
Okay. One other quick note is that when you're going from this floor to the meeting rooms, do not take the stairs. The stairs are for fire, and you won't be able to exit on the, we discovered that the hard way. And there was a fire alarm this morning that was a semi-false alarm. We hope it will not happen during the conference, but if that happens, then we will take the fire alarm, the stairs. So it's my pleasure to introduce our keynote speaker, Dr. Paul Spiegel, who is the director at the Johns Hopkins University Center for Humanitarian Health. Paul has had more than 2 decades of managing humanitarian crisis response in more than 30 countries. So we're going to be really gifted with a lot of good experience and thought leadership today. And prior to his appointment at the director of Johns Hopkins Center for Humanitarian Health, Dr. Spiegel was a deputy director of the Division of Program Support and Management at the UNHCR in Geneva. He was chief of public health. He worked with HIV/AIDS along with UNAIDS. And before UNHCR, he worked with Center for Disease Control also in the International Emergency and Refugee Health Branch. He is an epidemiologist and doctor by trade, and he has responded to crisis and undertaken field work and research in humanitarian emergencies, as well as published and lectured extensively on this topic. Please join me in welcoming Dr. Paul Spiegel as our keynote speaker.
Great, thank you. Good morning, everyone. It's a pleasure to be here, and thank you very much, Lisa and Mohini, for the introductions and the invitation to be here. I'm going to, so clearly I'm a humanitarian, and it took me a long time to become and understand development, and so most of you are far advanced as you're more development people. And it actually took, for me at least, it was the Syrian crisis that made, I think, a huge leap in humanitarians' way of thinking, and particularly with Lebanon, when you have 1 in 4 or 1 in 3 people that are actually refugees. And when I was at UNHCR working with the World Bank, realizing, and I think also the bank, really changing the way they do things, realizing that with the amount of people that are displaced, that you can't not deal with that and deal with development. And so this idea of the humanitarian development nexus occurred. Nexus, and I'll talk a little bit about this and why we came to the word nexus. So I'm going to briefly talk about and I want to speak for about 35 minutes and then leave around 20 minutes or so for question Q&A. So I'm going to talk about the magnitude and the cost of forced displacement, describe some of the changing humanitarian trends, and then explore the humanitarian development nexus. This is famous, one of many famous pictures, and I was in Greece for a while, and it was extraordinary seeing the people, refugees and migrants coming here and just seeing the life jackets and the colors of the life jackets from kilometers and kilometers on the coast. And so the question, and I have a couple of these, humanitarian or development, probably it should be humanitarian and development. So David mentioned there are well over 65, this is the end of 2016, but there are 65 million forcibly displaced persons. Just to get the terminology correct, we have internally displaced persons, those that have not crossed a recognized border. They are the largest of approximately over 40 million people. And they are the ones often harder to reach than refugees. And then refugees, approximately 22 million people. They've crossed an internationally recognized border. There are 2 big agencies that deal with refugees, UNHCR, as well as UNRWA, the UN Relief and Work Agency that deals with Palestinian refugees. And then we have asylum seekers that are seeking refugee status but have not yet been granted refugee status. So again, IDPs, the largest number, refugees, asylum seekers, and then throughout all of this, either displaced or non-displaced, we have approximately 10 million people that are stateless. And the largest number are the Rohingyas. We call them refugees, they're stateless people. So where are we? And unfortunately, this hasn't changed. It's not a static situation, but over 55% of refugees come from Syria, Afghanistan, and South Sudan. And before 7 years ago, before Syria, the Syria crisis, the largest refugees were Afghanistan, always Afghanistan for many, many decades. They're in Iran and Pakistan. South Sudan has really increased, but there's also been Somalia, which has been going on for decades. And one of the key issues is decades. A lot of these situations are very protracted. IDPs, we can see here where the largest numbers of IDPs are. Syria, DRC, Sudan, Iraq, and Colombia. One of the things that you will see is that a relatively small amount of countries make up the vast majority of refugees and IDPs. So this is what I'm talking about here. The same 10 conflicts have the majority of forced displacement every year, and it leads to the same countries bearing the main responsibility for hosting both the IDPs and the refugees. And the other really important issue is we talk a lot about resettlement, moving, this is for refugees, resettling refugees usually in high-income countries like the US, Canada, Australia. That is less than 1% of all refugees. It's a really, really small amount, small number. And what's most important to come across is that it's low and middle-income countries that by far are bearing the brunt of forced displacement. And then secondly, the other thing that's quite important is outside of camps. And this is one of the new trends. It may not even be a trend, but for the most part in the past, we really concentrated on refugees and IDPs living in camps. It was easier, and we mostly ignored those that were outside of the camps. It took a long time for UNHCR to develop an out-of-camp policy. And more now, we're looking at forcibly displaced persons living out of camps. And I think that's another impetus to work with development, because when people are outside of camps, what are they going to do? They're going to be accessing national services, and therefore that's going to be affecting national services and the development. When they're in camps, they're often dealing with parallel systems which are not sustainable and take away a lot of people's dignity in terms of movement. So where are we in terms of funding for humanitarian assistance? There's been actually a dramatic shift upwards to 2016, same in 2017, of about $28 billion, which seems to be a fair bit. And when you look at the increase, it's up 12 billion from 2012. But what isn't shown here is that in 2016, we had the largest gap, which was 40% of what was asked and what was received. And so that the problem is that although the money is increasing, it's not keeping up with the demand. And that's because of Syria, because of Central African Republic, because of South Sudan, but it's also because of the protracted nature of these situations. Refugees are refugees for on average at least 10 years, and conflict is becoming longer and longer. So we have new crises, and on top of this we have the protracted crises. So there was a 40% shortfall of funds, but of course the shortfall is not equal. And Syria, Syria and the Syrian refugees, although there's not enough money, they received the funding requests for those people, the Syrians and the Syrian refugees, was significantly higher than those, for example, in Central African Republic or in Mali. And even Bangladesh right now, the Rohingya refugees in Bangladesh is not receiving nearly the amount of money. So the problem is there's been an increase in the amount of money. It hasn't kept up with the pace. And because humanitarian aid, like development aid, is often political in nature, governments choose where they put it, and it's not equal. So there's a huge inequity within this aid. So where's the money going? The recipient countries, and where are they coming from? So classically, the US is the #1 donor, followed by EU and ECHO together. Turkey is new, and that's because Turkey is providing, and whether this is exactly 6 billion, hard to know, but Turkey is spending a tremendous amount of money. They have the largest number of Syrian refugees now. in that country. And unlike others that are relying on the international community, at least before, Turkey really did spend a tremendous amount. So again, you see a key amount of countries, Syria, Yemen, Jordan, South Sudan, and Iraq, that are receiving the largest amounts of funds. And these are all one-year funding. This is the problem in humanitarian. We want to deal with development, but humanitarian is one-year funds. What is pledged is not always given. So again, this is Zatri refugee camp in Jordan. It's a massive camp. It's one of, I can't remember now if it's the second or third largest, let's call it a city. It really is a city in Jordan. It's huge. So we have norms, and much of our humanitarian norms were really developed in low-income countries in sub-Saharan Africa. So the norms are low-income countries in sub-Saharan Africa, persons in refugee camps, weak governments, and few functioning national NGOs, and communicable diseases, because it was mostly in sub-Saharan Africa. This is still occurring. I mean, what's happening in South Sudan, Central African Republic, these issues are still happening. But on top of that, we have new norms. We have middle-income countries, starting with the Balkans, Kosovo, Iraq, Syria, and the humanitarian community was not prepared to be able to address these issues. We just weren't used to it. We had to develop protocols for cancers, for renal dialysis, issues that we really hadn't dealt with, a different demographic profile, a different disease profile with non-communicable diseases. So some of the key trends. 90% of countries have a humanitarian appeal for over 3 years, which means it's protracted and protracted. We're trying, as I mentioned, these are one-year appeals, but when you know that these conflicts and then the refugees or IDPs are going to be there for multiple years, we need to be thinking in multi-year terms. But we're not there yet. It's slowly coming. One of the other big issues is humanitarian is still very paternalistic. It is most of the money goes directly to the UN, international NGOs. Very small amount of money actually goes to the local and national NGOs. Yet again, we're seeing stronger governments, more capable local NGOs. There was a shift in the humanitarian summit by 2020 to have approximately 20% of these funds going to national NGOs and governments. I don't think that's going to happen, but inevitably, the money will be going more and more towards national governments, towards governments and national NGOs. I think that's a very, very good thing, but it also puts into question what will be the future role of the UN and international NGOs. And for those of you that have worked in these agencies, once an agency is there, it doesn't like giving up money and power. And so how that's going to play out, we'll see. We're also seeing a huge increase of actors, particularly the private sector, which I think is a very good thing, and we're learning how to deal with the private sector. We're seeing Islamic agencies that don't necessarily follow the classic Western norms. Again, I don't think that's a bad thing, but how we work with them when some of them are on US-sponsored terrorist lists makes it very complex. The other big area I want to talk about briefly, because I was asked to give an overview, but these are the areas that will have big effects in the future, are cash transfers. And again, this came of age, it's been going on for years, but this came of age with the Syrian crisis, IDPs and refugees. And in the past, what we did is we primarily gave in-kind, food, blankets, tents, jerry cans. We're now moving towards cash, and it worked very well and is working very well in Lebanon and Jordan because they have very good functioning financial systems. Now it's working extremely well in Kenya and Somalia through cell phones. So we're working with the private sector, we're working with banks, we're dealing with ATM machines, with mobile phones. The issue, though, is there's sometimes confusion where we're thinking of cash transfers in terms of livelihoods and in terms of establishing resilience. There is that, but this is really meant to be just a change from in-kind into cash. There are a lot of really positive things with cash. Dignity, you're giving to forcibly displaced people, you're giving them the right to choose what they want to spend on. You're spending it in the local economy, again, very good for development. But there are also a lot of questions, particularly in health and education, about how this will work. It clearly has worked well in the nutrition and food security, commodities area. How it will work in terms of health and education, when you also need expertise, buildings, infrastructure, is still of question. This is a powerful picture, I think. I mean, those of you that have been in Lebanon, you see, and Jordan, you see Syrian refugees. In fact, sometimes they blend in, but they are just interspersed throughout the whole community. So the humanitarian development nexus. You know, I searched and I couldn't find a very good definition for it, so I just made this one up. And I checked it with my friends at the World Bank, and they thought it was okay. So it's a connection between humanitarian and development organizations where the groups work together, but not doing the same thing, trying to be complementary in a concerted measure to address the humanitarian requirements, but also taking into account the current and future development needs. And one of the big issues here is we were often used to working with, for UNHCR, for refugees, for other IDPs, it's a group. And we need to really think in terms of area-based, and we need to not get away from, and this is going to be very difficult, to get away from mandates. We're working in areas where, if you look at Lebanon, there are many vulnerable Lebanese, there are many vulnerable Syrian refugees, so we need to look at systems, and we need to get away from looking at a status of a person, yet while taking into account some of the status. As a refugee, you're not going to have the resilience, you're not going to have the safety mechanisms, you may not have access to social safety nets. So there's our tensions here that we need to work on. Oh good, it's better there than it is on my computer. This is a slide from André Griekspoor from WHO, who's working on this together with us, and it tries to show in a very simplistic way the differences between humanitarian and development. When I was at Hopkins 21 years ago, doing my MPH, we were still talking about this. We called it the humanitarian divide or the humanitarian development gap. It still exists. I won't go through this. There are a lot of acronyms here, but even in terms of the planning, if you look at the planning framework and tools, they're completely different. We have humanitarian response plans, humanitarian needs overviews, and then we have the UNDAF, and we have national, I'm concentrating on health, so national health plans and strategic plans. They rarely work together, and there is such a divide still between the humanitarian and development community. But we have the SDGs, we have the Agenda for Humanity. So there is a newer way of thinking. It's going to take a fair bit of time. And this is similar to the slide that Lisa showed, where we need to start looking and doing joint analysis. And you will have these slides, so I see some people don't. You'll get these slides. But joint analysis, defining collective outcomes, and looked at programming, joined up programming. This is going to be it's easier said than done, and I'm going to give some examples of how UNHCR was working with the World Bank. But the one thing I want to emphasize, I was just in Geneva last week, and I was meeting with the High Commissioner of HCR, the Commissioner for Refugees, and there's a lot of enthusiasm about this, the idea that others will be taking over some of the roles and UNHCR will play a more complementary facilitatory role. Just want to mention it's going to take a long time for this to occur. The bank works on a completely different time frame than UNHCR. The concept of allowing refugees and then IDPs moving into national systems, avoiding parallel structures, providing, improving the national systems themselves is good in theory. It takes a long time, and then in many of these situations, either there aren't sufficient in some of these countries national systems that exist. You can't just start from scratch. And then secondly, a lot of this, they're overwhelmed, these systems. And so there will always be a need to be working at both. And so I want to just caution, the same as with cash transfers, it is transformational, but it's going to take time, and it's not going to be, there is no silver bullet. This humanitarian development nexus is really important, but it's not a panacea, and so I want to mention a bit of caution here. So the development approach to humanitarian emergencies, and this is a slide from the World Bank, it's anchored in poverty reduction. You can read, I think that what's most important is looking at the comparative advantage in financing and analytics, is really, really important here. I think the humanitarian world is a little bit more slapdash. We try to do our best in terms of data and analytics, but it's often of very poor quality for obvious reasons because of the insecurity. Financing is a whole other area, and I'm very excited about some of the financing mechanisms that can be put in place in the humanitarian world with development, and I'll talk about a few, but I think we can learn a lot from catastrophe bonds for natural disasters, and we can learn a lot from the pandemic, the PEF, the Pandemic Emergency Fund, but there are also a lot of limitations there too, and the PEF is now being tested with Ebola, and we're seeing a lot of issues coming up. So what we're looking at is the humanitarian will still always look at the immediate, the acute, and some of the development we should be working at thinking, which humanitarians don't do very well, thinking in the long term, and the development looking at the medium term and the socioeconomic dimension, of which we didn't do very well in the past. So looking at the displacement are distinct from other poor, and this is where, again, we need a nuance. So even if we look at an area-based approach, some of the issues from the displaced will be very different from their neighbors who are actually also perhaps equally vulnerable, but maybe they didn't go through the same sort of tensions, the gender-based violence, maybe they don't have the same mental health issues. So we really need to look at this. Maybe they don't have the same extended family near them. There are a lot of distinct issues that we need to take into account, but we also have to recognize in the past we, as the humanitarians, exacerbated tensions between the host communities and the forcibly displaced. Unfortunately, because we had donors earmarked money just for those people, the displaced are giving up a tremendous amount, whether it be their own money, whether it be their facilities. In Jordan and Lebanon, you see from the schools had to move towards double shifts and even triple shifts so that the host population's education actually was very much affected. So these are issues that we need to consider. This is what, as I was leaving UNHCR, the World Bank and UNHCR are working on something that's quite, I think, quite revolutionary. It's taking time. And a lot of this has to do with Jim Kim of the bank, and a lot of it really does have to do with the Syrian situation, which in my mind, the Syrian situation will affect humanitarian work the same way as Rwanda did in 1994 in terms of saying we need to have standards and we need to have accountability. So the bank has set up a global concessional financing facility. This is primarily, but it will expand, but this is new because it's for middle-income countries hosting refugees. So this was for Lebanon and Jordan. And what's important is that these loans, which are very low interest, go directly to the governments, as opposed to the UN and the international NGOs, to help support the government in dealing with with refugees. So that's new, and I think right now, my numbers may not be up to date, but they have 375 million, of which has gone to Jordan and Lebanon, and their goal is to raise 1.5 billion. What's also new is this IDA-18 refugee sub-window. The money hasn't started flowing yet, but the concept here is that these countries, anyone that has over 25,000 refugees or more, and or I think it's over 1%, I have to verify that, I think it's over 1% of their population refugees, the World Bank will give low interest, again, concessional loans to these governments, and what the governments need to do is come up with a plan, just how they're going to improve services for their own people, but take into account refugees. This sort of thinking is new. I mean, it really did not occur in the past. The question will be how quickly this can occur. The bank and HCR and a lot of organizations are now undertaking they're undertaking the assessments to get this done, but it really will require the bank to actually work and move much more quickly. It also requires UN agencies and international NGOs to realize at the beginning we thought, oh, this is great, we're going to get money from the bank through our agencies. But that's not what's going to happen, and I think that's a good thing for development. It's going to go through governments, but it's going to require the governments to actually think about refugees or internally displaced persons. In this case, it'll be refugees. So, how am I doing on time? Well, so some of the elements of success, if we will have success here, and I think we will, is there is a new impetus and political focus. in the past, whether it was with the bank, whether it was with Gates Foundation, a lot of donors, there was a divide between development and humanitarian, and that there still is. But if you look at some, such as Canada, where I'm from, Australia, their development humanitarian organizations have actually, the government organizations have merged together now. So already that's positive. It hasn't happened yet in the US. Syria, I think, the number of complex situations around the world, with 65 million now more who are displaced, and the geopolitical implications, I think, is what is really moving this now. If this had happened in certain areas in Africa, particularly French-speaking Africa, we probably wouldn't be speaking in the same way. The importance of the Middle East in terms of the geopolitical aspects for the US and the West, and if you noticed, when it really started to take shape here was when you had so many refugees and then migrants moving from Turkey into Greece and then Libya into Italy. That's when a lot of things changed. And so, you know, we shouldn't be, hopefully I'm not jaded, but it's really important to recognize that a lot of these changes occur when, sadly, these conflicts are affecting Western countries. That's going to change, I think, as well in the future as we look at now more and more China and other countries that are moving in that aren't following the same Western and humanitarian values. There are many new actors, and it'll be really interesting to see how we'll work with the private sector. There are opportunities, potentially, for humanitarian bonds. ICRC has some already. We when I was at UNHCR, we actually were negotiating, and we succeeded with Iran to negotiate 220,000 Afghan refugees to have access to health insurance. And part of the key to this, and I mentioned beyond just, I haven't mentioned two very important issues. One is the communities and working with the communities, and that's still in humanitarian, except in the emergency phase, a difficult issue that we haven't dealt with. But we have moved towards working with communities, even in South Sudan, for example, moving to community health workers, providing antibiotics, providing malarial treatment, task shifting. But it's not easy, and as we move in towards more with middle-income countries, we're getting a lot of pushback from healthcare professionals, doctors, and nursing organizations that don't want this to occur. The money issue will always be there, I think, and this is where we need to, as I mentioned, we need to look at innovative health financing. There's not enough money anymore, and with the hugely rising tide in populism and anti-refugee, anti-migration, and it's not just, as we all know, in the US, but it's expanding in Europe, there will likely be a reduction in the amount of money for humanitarian from the West, where there already is not enough. So to make this work, we need to have non-traditional actors and non-traditional mechanisms for financing, but we also need to work with the development and try to see how we can work more closely together. Speaking the same language, I'm just going to talk on a couple areas. When we first started to work with the World Bank and with UNHCR, we truly didn't understand each other, and it's still, we needed to develop a joint lexicon, a joint dictionary, because both we as humanitarians have a huge amount of acronyms, as does the development community, and we would be talking over or around each other. Our time frames were completely different. We're still not there, and we had a lot of problems early on getting our representatives from UNHCR to go to some of the development meetings, particularly when there were so many acute aspects on their plate. So it's still a big challenge, but it's a new and exciting time. I think we should embrace it and move forward, but also not with skepticism, but at least with realism that it's going to take time. And one of my concerns is that UNHCR or certain international NGOs will say, okay, the development and the government and the development sector is going to handle this in the near future, and therefore we don't need to do it, and then a lot of things will fall down. And that's when I met with the High Commissioner, some of the discussions that we had. It's going to be slowly over time, but it's a new world, and I'm very, very pleased that that the core group has brought this up as one of the key topic for this conference. So with that, thank you very much, and I'm happy to take questions.
Thank you for that thoughtful conversation. Let me take a move in. Thank you so much for highlighting and laying out the framework. And a lot of the conference will be picking up on the themes you've laid out for us. I know there's a panel, the plenary tomorrow will talk about a live case with the Rohingya, an ongoing case of trying to marry humanitarian and development professionals. And the last plenary is also on the financing of the nexus, or humanitarian and development. You're open for questions. We would love to invite questions. We'll take them in groups of 3, and please just let us know who you are. Thank you.
Hi, good morning, everybody. I'm Ruth Madison with USAID Now. Hi, I get to be the first one. This is great. Thank you so much for the presentation. I am just coming back from South Sudan, where I was for a year, so I love this place. I love the people there. One of my questions was on the Global Concessional GCFF, because I'm USAID, we like acronyms. Is there a way, or is there any discussion of including other countries such as Uganda, which has received an enormous amount of South Sudanese refugees, into that program? Thank you. Thank you.
Let's take some more questions. Thank you.
Hi, Emily Chambers-Sharp with MedAir. Thanks for your presentation, and I wondered if you could speak a little bit more to us. You were talking about anchoring humanitarians in a poverty reduction mandate, and I think especially for a lot of us, we think life-saving, immediate, urgent, but do you have any ideas, maybe a bit more practical frameworks of how do we marry those ideas?
Hi, good morning. My name is Agnieszka Sykes. I'm with USAID. I had a question about the kind of the planning, operational side of getting partners on both sides of the spectrum to work together. For me, there's no incentive. I mean, my perception is there's little incentive for humanitarian partners to really, and there's not the luxury always of time to try to pause and think very deliberately about how to do long-term planning. So while kind of the table that you had up earlier is what we're all trying to move towards, how do we incentivize them to think about some of the longer term planning? And I would just say with your definition of that nexus, I would also include the connection not just between organizations, among organizations, but government. One of the things that I support the DRC, and one of the things that we found with a recent outbreak and conflict in one of the provinces more recently is that the Ministry of Health themselves, they're not prepared to deal with that kind of fluidity in terms of moving back between like chronic conflict or intermittent conflict. And so one of the things that we were suggesting is that when they're doing their annual planning, plan for emergencies and crises and have some kind of line item to address that if it does occur. So I would just expand a little bit that definition to host governments and other organizations.
Thank you. Over to you.
Thank you. For the GCFF, the Global Concessional Financing Facility, that's specifically for middle-income countries. We have the IDA-18 refugee hosting countries, so Uganda actually is one of the countries where they have already started a discussion with the government and with the humanitarians and the development agencies. So that is happening. A lot of what we're talking about still is, both for the last two questions, is still conceptual and needs to work out. One of the areas that I don't think I highlighted sufficiently is this issue of livelihoods. And it took me a long time to actually understand the importance of livelihoods amongst refugees and IDPs. And one of the problems still, and this is going to be a political problem, it will not be easy, is refugees, in order for them to live outside of camps, they need to have some sort of income. If you put refugees in camps, it's horrible. You're warehousing refugees, you're losing dignity, but in theory, they don't need livelihoods because they're getting everything, although they're of course not getting everything, it's always whittling down. But as we move towards they're already out of camps, most governments will not allow refugees to work. And we kind of understand that because in many countries you have such a high unemployment rate, particularly amongst youth. So it could be politically very difficult. You see what's happening right now very worrisomely in Jordan right now with what's happening. So if King Hussein opened up to say, well, we're going to have maybe 650 to 1 million refugees start working. So what the bank and others are trying to look at is to say, and this is with the European Union and the US, is number one, do the refugees and IDPs have certain professions that they can work in? Right now, we have over 10,000 Syrian healthcare workers that are not allowed to work in Jordan and Lebanon. Turkey started to allow them to work primarily in refugee clinics, primarily because of language issues. And then in Europe, Germany has been actually quite good at allowing fast-tracking these healthcare workers to get permits, licenses. So one of the issues will be livelihoods, and if we can try to crack that nut, what the European Union has done also, although quite controversially, as you know, they're spending $3 billion, then another $3 billion, and apparently another $3 billion will go to Turkey to cut the flow off to go to, which is quite controversial, and I don't support that. But they have done that, and what they're trying to do is work on zones, allowing goods to come into the European Union from Turkey, Jordan, and Lebanon, where both the national populations and the refugees can work together, and then these goods will be reduced tariffs. So the long and the short of it is to look at, I don't think humanitarians will be dealing specifically with poverty reduction of the nationals, but thinking long term. And if we could start early on to allow refugees to have working with refugees to have livelihoods, they could then pay for services. And this whole idea of my area in health insurance is that if you get enough, it can't be only the sick that are going to pay, because that's too much for the health, that doesn't make sense financially. But if we can work for all refugees to have to pay into health insurance, you increase the risk pool and you improve the national system, and then one group, UNHCR or someone else, will pay for the most vulnerable. The last two things, I agree in terms of governments in the definition together with communities, which probably we haven't emphasized enough, and as part of this conference. It's not going to be easy, I think, to get humanitarians to work with development agencies, particularly when we saw that they're working in these acute phases, but also they're not going to be getting the money, which I think is a positive thing. It should be going to the governments and the local NGOs, but that will be a disincentive for humanitarians. So we need to figure out ways to incentivize. One of the concerns, and again, if we look 5, 10, or maybe 10, 20 years down the road, when we move in this direction, also together with cash transfers, is that international NGOs and UN will not have the same amount of money, the same structure that they will have in the future, and how they deal and address this is still questionable.
Thank you. There was a question here.
Yes, I'm Emily Mangoni from Apt Associates, and you had touched briefly on the emergence of new humanitarian donors, such as China, and we see the same thing in development, and so I was wondering if you could talk a little bit about how their approaches differ from Western approaches, what we might be able to learn, and how we might be able to partner in the future. Thank you.
I saw another hand, 2 hands in that corner.
Thank you. I'm Michaela Arthur. I'm a health advisor with USAID Asia Bureau. And my question is, especially as government donors, how do we maintain the apolitical nature of humanitarian assistance while integrating the more political development programming and funding? Thanks.
That's great. We'll take a third question from that corner, and then we'll come back to this side.
All right, good morning. My name is Walter. I work for CARE in Bangladesh. And my question was around the whole nexus conversation that you just put up. And I think probably may need to think a little more about, contexts where that is just cyclic. I mean, not just because you have a refugee movement, but you have disasters, Horn of Africa, floods like we have in Asia and other places that just are just on and off. So it's not really that you have the opportunity to define your situation as one or the other, and probably more of seeing that as, it's a perpetual ongoing process. I would like to hear a few of your comments on how you look at that in terms of, the challenges you just put across for funding and the terminologies and the relationships. Thank you.
Sure. Thank you. Great and difficult questions. I'll start with Nicole, the apolitical nature and then the political nature of development. Even though we have the humanitarian principles of independence, neutrality, humanity, impartiality, independence, and neutrality, humanitarian aid is very political. I think no matter where we, particularly with donors and where it goes. Perhaps it is impartial in theory. It's a really difficult question that I think is becoming even more and more complex right now, and I'm less hopeful than I have been for decades in the current situation right now, when we're seeing governments move towards more populism and very much not only an anti-immigrant, anti-refugee, but in many situations an anti-certain religious group, particularly Muslims in this case, and even a preference towards providing care and or resettlement to a certain religious group. So the answer, I guess, would be, it's not an easy answer, I think would be advocacy, but a lot of us have been trying to do this, and one of the problems, and this is maybe something that could be talked about at the core group, is that we have been trying, and we've been publishing in New York Times and in the Lancet facts to try to talk about how refugees in the US, the benefits that are occurring, but the problem is we're not able, I don't think yet, to reach the right people, and sometimes we're just like the way the internet is working, when we're working with New York Times or the Lancet, we're already working with people that see the world in a very similar way, and we need to figure out ways and argumentations to get to the people that don't, and that's something that's been stymieing me and I think many other groups in the last while. In terms of Chinese in the Middle East, I have less experience with the Chinese and the humanitarian, but they have increased their giving to UNHCR tenfold, but it's still relatively small. But we do have a lot of experience with the Syrian situation and the Middle East. And what's happened, at least from the Saudis to the Kuwaitis, from UAE, there has been a lot of money coming in. I would say number one, and especially in the health and education, they want that money to be seen, so they want a lot of infrastructure, which I think is not always the way to go. And in the health, they want something, again, hospitals, they want more curative, and they're not necessarily thinking in broad public health terms, which is a better bang for your buck. There are a lot of Islamic charities that are coming in, and they're often very political in nature, and it's been difficult for us to try to work with them for a variety of reasons. Either they don't want to work with the UN or international NGOs, or we're not able because of some of the terrorism issues and rules from the US and other regulations. So it's a challenge, but we're trying to work through intermediaries. And the key thing, let's say in Lebanon and Jordan, was that we moved over time, as the money became less, we had to move more towards public health, spending less for tertiary care. But many of these Islamic organizations were happy to pay for cancers and renal dialysis, but we needed a better way to, and I think we've improved over time to work with them. Finally, in terms of the cyclical nature and this idea, yes, we can't think of this in terms of separate conflict, natural disasters. A lot of this is clearly cyclical, and Bangladesh is a good example. The natural disasters, it's still limited in focus, but I'm thinking still in terms of innovative health financing and preparedness. I think that's improved, and as I said, you have catastrophe bonds, you have improvement in preparedness for the way the infrastructure can be rebuilt. We don't have the same in conflict, and we can see a lot of this. The Syria situation was not easily predictable. South Sudan was clearly predictable. Burundi was and is predictable. It's not over yet in Burundi. Central African Republic. We don't do preparedness very well. I don't think donors give enough money for preparedness. And I would say that we develop a lot of preparedness plans that are more abstract. And when we actually want to move towards implementation, either we don't do it well or there's not sufficient implementation to do it. There have been significant improvements in terms of warehousing of goods, but a lot of other areas, and in particular the humanitarian financing, I think could be done. I mean, one idea we have is, could we bring in private sector money to help fill that initial gap of 40% for acute emergencies, yet working with governments to make sure that there would be a guarantee that the private sector would recoup a certain amount of money, which would then reduce the amount of risk and therefore reduce the amount of interest that would have to be paid. So there's a lot of work that can and I think will be going on in this area.
Wonderful, thank you. I see 3 hands here. I'll start with the gentleman in the back. Lisa, come to you, and then the colleague sitting at the table right behind Lisa. Thank you.
Hello?
If somebody could please bring a microphone to this gentleman. Very sorry, we'll come to you next. We still have time. We'll start with you because I think you had your hand up prior as well. Thank you.
So my name is Samuel Usman. I work for Call Group Polio Project back in Nigeria. I have a question and a comment. My question is, from my experience working in the northeast of Nigeria, where you have Boko Haram insurgency and you have over 3 million people displaced, accountability for the resources of the displaced is an issue. So as we talk about the connection or the nexus between humanitarian and development, provision of development services, we need to look at the accountability for those resources as they pour in. You have lots of resources coming from donors, from government, from private sector, and the accountability framework to ensure that the humanitarian support gets to the end user needs to be put in place. So the question is, what is your experience on how to improve upon that kind of scenario? Because in Nigeria, for instance, you have millions of people who are in need of livelihoods, who are in need of food, who are in need of all kinds of support. And when this support does come, sometimes they are left with the shorter end of the stick. Thank you.
Thank you, Paul. First, I want to thank you for mentioning the concept of dignity with cash transfers. We know that we all want basic human needs to be met, but that is so important. So thank you for mentioning that, as well as mentioning that some of the lessons learned from refugees and the dialogue can actually help how we work with refugees in the United States and how to do that better. My question has to do with this transfer of responsibility and funding to national civil society and governments. I think we know this is the million-dollar question. Administrator Green from USAID has said that that isn't his objective, to hand over to ministries and national civil society, which we should. How do you recommend that we get there and train in is it training, cross-training in humanitarian development? Is it annual work plans and strategies? How should we do this? Thank you.
Right behind, the lady in the white jacket. Thank you.
Hi, thank you for this. I'm Tanvi Monga with the USAID Maternal and Child Survival Program. Sorry, excuse me. I was wondering if you could speak a bit more about what has been termed the climate change refugees, and given the predictions of increases in the future for these refugees and the impact that will have, climate change will have on health and nutrition. Thank you.
Would you be okay with taking one more question? Yeah? The gentleman in the back who had the mic initially, thank you. And then we'll stop here and do another round.
My name is Yahya Zakou. I work from Catholic Relief Service in Niger. So my question is about the host communities vs IDPs and refugees. I want to understand just your experiences about the taking consideration of these host communities. I get experience from Marawa in Cameroon. After the attack of Boko Haram, the economy is rolls in very low, and most of the effort is concentrated to IDPs and the refugee. So I want to just to understand your experiences, how to both take in consideration host communities and IDPs in this case of situation. Thank you.
Thank you, Paul.
Sure, thank you for the questions. Nigeria, which I didn't even mention, is another incredibly important and difficult area. And accountability is also very important and very difficult to deal with. There is something called the Good Donorship Initiative that has been working for a long time. There are a couple issues that we're working on now over time. Is that one is one of the biggest problems. It's always been there, Somalia, Afghanistan, but we're working in certain areas like northern Nigeria, Yemen, different parts of Syria, where we really have difficult access issues, and therefore we're relying on either nationals. We're relying on nationals, and one of the problems there is risk transfer in terms of security. And Lisa had mentioned the amount of workers, humanitarian workers that are being killed. So there is an ethical issue on top of everything else. So that's number one. Number two is, particularly in Britain, if you read The Guardian, they have a very good humanitarian column. And one of the issues that's becoming more and more complex is that governments, which I understand, it's taxpayer money, so they're demanding more and more outputs, or particularly indicators in terms of outcomes and impact, of which we are notoriously very bad at measuring. For the most part, when you look at humanitarian response plans, we recently looked in Nigeria and in Yemen and Syria, nearly all of the indicators that are being reported are process indicators, how much was distributed. It's not looking at the outcomes, and it's certainly not looking at the impact. It's very hard to do that, and we are actually at Hopkins and others have a grant from Gates Foundation to be looking at this to try to see how we can improve it. But it's an extremely difficult situation, and it becomes more and more difficult in terms of accountability of organizations as it becomes less accessible to security. So there is an increase in corruption and an increase in deviation of goods, possibility of money and goods getting into Boko Haram or other areas, which then has a vicious cycle. So not a very easy way to do it. One of the ways, at least, that HCR and others was doing in the past in Afghanistan in terms of reconstruction, when we couldn't get there, was working with workers who had phones, and then they would be able to take a picture of what was being reconstructed, and you can use geo-coordinates to make sure that they were actually there. But it's going to be, it's a very important issue, and it also, I think, relates to Lisa's comment and question in terms of national organizations. And one of the issues that's come up consistently is that these international NGOs and UN agencies have incredibly big bureaucracies that can deal with auditing and can deal with the fiscal responsibility of reporting, and it's incredibly daunting to all of us, but it's particularly ECHO grants, but also ECHO, DFID, USAID, OFDA, PRM. The reporting is quite stringent, and a lot of the national NGOs will not be able to actually meet a lot of the requirements that these donors are demanding. So part of it will be cross-training. It didn't work particularly well in Haiti, for example, as many of you know. And this has to, again, come with this idea of incentive of how can we get international NGOs and UN to work themselves out of jobs. That's not going to be easy. So I think it's going to be a big challenge. And I believe, I've seen this in terms of healthcare. We have moved to, in many long-term camps, to national NGOs. We pay them less. The outcomes are not as good often, but they may be just as good as what is being provided to the local populations. So one of the big questions for the donors and all of us will be, will we accept less stringent reporting and auditing in fiscal areas, which may mean more chances of money going astray, and will we accept perhaps not the same output and results that we may with some international NGOs. The last question, climate refugees. That's difficult, and it's obviously going to be becoming more and more difficult. There is, many of you are aware, there's the compact for refugees and the compact for migration that's coming up. So climate refugees, in theory, don't meet the 1951 Refugee Convention of persecution, fearing persecution, but there are changes, and you have the Cartagena Declaration, which works for Venezuela, and you have where they would be considered refugees because and you have the AU definition of refugees that has used the 51 Convention but expanded it according to their specific interests. One of the problems right now with these two compacts, so these are big meetings that are going on to the Compact for Refugees is actually to try to figure out, look at the humanitarian development nexus and to get governments to agree on how to deal with, particularly with refugees and sharing the burden. The problem is in this political environment, it's really difficult, and so I remember very distinctly there was discussion of UNHCR and IOM, International Organization for Migration, to have one compact of refugees and migrants, and UNHCR was going to say there's no way we're going to do that because we didn't want to open up the concept, even the definition of a refugee, which is limited still. The definition could be expanded, and maybe at a different time that could have been a possibility. But right now, in this horrible political climate, opening up anything in terms of a definition of a refugee, it's likely it will be even more restrictive. And that's why we have two different, and if you look in the Compact for Migration, more and more countries, including the US, Hungary, and others, are talking about even just stepping out of that compact. I think the US has already stepped out of the compact. So climate change refugees, there's a lot of work on that. It's going to be a reality. People are going to move. Probably in many situations, at least at the beginning, it'll be more internal displacement, but it depends where they're located. And that's about the limits of what I can say in terms of next steps. I don't know if people know really what will be the next step in terms of the legislation. And then finally with Niger and Marwa and Cameroon, I spent a fair bit of time actually in that area about 3-4 years back. This is a good example, I think. Well, there are two issues there. Number one is because of the insecurity in that area, the government insisted that in Niger and others that we have camps. And if we have camps, which we want to go away from, camps will very much concentrate on refugees, and in this case refugees, but in Cameroon, IDPs. In Cameroon, the government allowed a mixture of some camps and then integration. But this is where the humanitarian development nexus would be applicable in Niger if we were able to have those Cameroonian refugees integrated within the areas of where they were living, and then the money not going to international NGOs, at least directly, but working with the government and trying to improve those local systems. I mean, the bottom line is if we can avoid setting up parallel health centers and education schools, but actually improve those that are existing or are part of the Nigerian plan, that would be beneficial for both the refugees and the nationals.
I see a lot of hands up. I think we can take 2 more questions, and let me go to this table. And Paul has kindly let us know that you're staying on, right, for the coffee break and perhaps through noon, so we can carry the conversation on outwards. I know it's fascinating, but I have the horrible job of keeping us on time. So thank you for respecting that. We'll take two all right, thank you so much. A question here, Adrian?
Okay.
And forgive me if I can't see you all the way in the back there, that's why I'm sitting here, and we'll take a question there and from the gentleman at this table. Thank you.
Thank you, for. My name is Bukar Largama. I work for Health Partners International in Nigeria, particularly in the Northeast, where the coaction is going on. And permit me to join hands with my brother, Usman, on the question of accountability. But my question is, I have been asked on many occasions, or we have been asked, we development workers, on many occasions, that why is it that we only react to the issues rather than finding solutions to the issues. That means we are not addressing the cause of the problem, but we are responding to the effect of the problem. So what is maybe this conference will help me to find answers so that I can be able to give out to my other stakeholders. Thank you.
From MedAir. You had mentioned that the Syrian crisis will probably change the humanitarian approaches similar to how Rwanda changed things. I'm just wondering if, as we go forward and we're looking at blending solutions, we ourselves as an organization found very different approaches and different solutions for blending at low-income countries versus middle-income countries. And you hinted a bit at that with your presentation. My worry is a little bit that we'll take the lessons learned from middle-income countries and trying to put that as a panacea on the lower-income countries, and especially where government capacity, as well as, in both sets, the ethnic aspects with governments and the conflict are key players. So I'm just wondering if this is on the global radar, if we as a group here looking for solutions of trying to blend community facility programming for health and nutrition, should be looking at those a little bit more distinct than lumping it together. Not that we don't have to always be context specific, but to me those approaches are a bit different and a blend, and I was wondering what your thoughts were and if this is on the global radar.
Thank you. Maybe I'll take the last question first. Yes, it's a really big concern. We always fight the last war, and so one of my concerns is, and I think a lot of people's concerns, is that there is, and some of my concerns are with the donors, where they're really putting on a lot of pressure, ECHO and DFID, on cash interventions, having one agency to do this, without sufficient data behind certain interventions. So as I mentioned, in health and education, there are a lot of questions. We're actually working with MedAir, Hopkins is working with MedAir to do a study in Jordan to look at how we can do top-ups for patients with diabetes, for example. But in low-income countries, let's see, I think there are certain areas, certainly we've seen in Somalia, the transfer of money via cell phones, and in Kenya, it's easily doable. But I have concerns as well as you do that there are a lot of the lessons learned in Syria, particularly as we mentioned with the Humanitarian Development Nexus, where you have functioning financial systems, health, education systems. That's not necessarily the case in some parts in northern Nigeria at this point, or in DRC. So there is a big concern that we'll be doing this. There's a whole other issue that I didn't mention, and Médecins Sans Frontières, MSF, has some concerns with the Humanitarian Development Nexus, rightly so, saying we have to be careful when we move towards governments. In some situations, particularly in refugee situations, if the government is supporting the refugees, that may be okay. In internally displaced persons or non-displaced, I mean, we don't talk about non-displaced, and there isn't a very good estimate, but likely not. People affected by conflict who are non-displaced are higher than 65 million. But again, we don't have a good estimate. But the worry is when you start working with governments and national NGOs, and you think about Syria, for example, that's not going to work very well. And so they're in certain non-government controlled areas. So we need to think very carefully, and I should have mentioned that should be part of my presentation, is that this approach of the Humanitarian Development Nexus, working with governments, is very context specific in terms of the government and national NGOs, in terms of how the government may or may not be supporting certain groups and certain ethnic religious groups. So we have to be very careful, and we as humanitarians cannot give up the principles of humanity, impartiality, neutrality, and independence. And so that's something that I think needs further discussion. In terms of Nigeria, and this is one of the question from the gentleman from Nigeria. The core source is, I talk a lot about this in Syria, which has been so frustrating when you look at how many, and not just Syria, Palestine, when you look at the Security Council and what's been happening in the Security Council. So, the bottom line is, particularly for humanitarians, it's very important, it's saving lives, but we can help perhaps move towards a core solution, but the core solutions are nearly always in conflict situations going to be political. And that's again why I'm pessimistic for the next, for the near future, because when you look at what is happening in the US and in certain parts of Europe, you look both at the global level, but then at the regional level with what's happening between the Shia and Sunni, there's going to be continued discord occurring, which means that there is going to be, and there's no way that, I don't believe that the Security Council is going to be revision of members or this sort of thing in the near future, and therefore I think we're going to have continued disagreement in Security Council. We couldn't even get, there's been resolutions in terms of healthcare and in terms of attacks, chemical attacks, but we're still not able to get, we're still not able to actually bring anyone responsible, and a lot of that is because you have different groups, in this case Russia, who will not admit to what's happening in Syria, for example, and nothing is able to be passed the Security Council. So I think the bottom line is it's political will in terms of solving these solutions, and the world is not particularly at a positive state in terms of addressing this, whether it be Syria, Nigeria, Central African Republic. So on that optimistic note, I'm going to say thank you, and I look forward to speaking.
I just think a huge thank you for this. You have given us, in a very short time, set the groundwork for the next 4 days. And you've given us a bird's eye view, and you've done it from the ground up. You've given us some cause for hope with new financing mechanisms, new actors, the work your UNCHR, the World Bank are beginning to do. But you've also given us room for caution, and that it's challenging and there's work ahead, and that's why we're all here. But I want to particularly thank you for bringing two words that are going to stay with us throughout these days, humanity and dignity. And thank you for that. And also to say that you will be with us for the coffee break. So for all of you with the hands up, my apologies that we couldn't be here forever. We wish we could kidnap you for the full conference, but you have an occasion to talk. Before we break for coffee,